morning. I'm Lindsay O'Neill, the founder of smallhinges.health, and I'm joined today with Brent Dorval. He is the CSO, the Chief Scientific Officer at KBMO Labs in Massachusetts. And we're going to be talking about food sensitivities, inflammation, and leaky gut today. Thank you so much for joining me. Could you please give a little bit of an intro on your background and all of the wonderful things that you've accomplished?
Yeah. Thank you, Lindsay. It's a pleasure to be here this morning. Again, my name's Brent Dorval, and I have about 35 or more years in medical device manufacturing and specifically in diagnostic type of applications for viral diseases, bacterial diseases, and also various other analytes, hormones, drugs of abuse, etc. My background is I got a Ph.D. from the Department of Medicine at Ohio State University in medical microbiology and immunology. And I was a postdoc and a visiting scholar in the Department of Chemistry at MIT for about 3 years, and where we were fortunate enough to work with a great group of individuals and discovered a unique way to stabilize polio virus vaccine. So that was a nice little discovery in the team that I led. Some other things that I've done is I was on the Committee for Vaccines and Diagnostics at the World Health Organization in Geneva, Switzerland, and I've been the Chief Scientific Officer of other companies that are involved in various types of diagnostic endeavors, including one where we discovered the first protein to be cloned from HIV back when that was raging about 1995. We came up with the first 60-second, one drop of blood test that would diagnose or certainly indicate HIV-1. So I've been involved in basically diagnostics for quite some time, whereupon I came upon an idea that the FIT test is based on, where we could measure both IgG 1 through 4 and simultaneously measure complement activation and the inflammatory pathway. And that is the subject of today's discussion, the KBMO FIT test, which measures IgG and inflammation.
Amazing. I mean, you have too much hair to have been in this practice for 35 years. And you are very well accomplished, obviously, one of the smartest people I've probably spoken to about food sensitivities and food allergies. And could you tell me the difference between the two? You just mentioned IgG. What is that, and how does that relate to food sensitivities?
Sure, great. I mean, I think everybody's probably familiar with a typical food allergy. And that's a situation where someone gets exposed to a chemical or a food and you produce IgE. So that's a type of antibody. And what happens is that IgE causes a type 1 or an immediate reaction to that particular antigen. And it can be so severe that you go into anaphylaxis and you need something like an epinephrine or an EpiPen. So its exposure causes severe reaction. It happens within the first minute, 2 or 3, and it can be life-threatening. Now, by contrast, you look at a food sensitivity that's mediated by IgG 1, 2, 3, and 4. So those are a different class of antibody. And what those antibodies are generated from foods or additives or certain environmental types of compounds. And what happens is those ingredients cause IgG to be formed. And generally, the foods get through the gut lining and through the epithelial surface into the lamina propria, which is the lymphoid tissue and the Peyer's patches. And what happens is IgG is formed, and then when IgG is formed, the IgG binds to the food antigen, forming an immune complex. And here's exactly where complement comes in, or the inflammatory process. That immune complex then activates complement. particularly C3. And what happens is it becomes bound to the immune complex and it splits off a smaller molecule. It's called C3A, which actually causes the inflammation. So the FIT test, where that comes in, is we measure the IgG, but after the complement is bound to the IgG in the immune complex, we measure a little flag protein that tells us C3A has been produced. So we measure the IgG plus a component called C3D. It's a little tiny peptide that's left on the IgG. And then what we do is we add a detection reagent that will measure IgG and the C3D at the same time. So what we do is we looked at a combined response for the IgG and C3D. So it gives you excellent sensitivity and very, very good specificity compared to other food sensitivity tests.
So you talk a little bit about complement, and the complement, it's a protein?
It's a pathway that ends up releasing an inflammatory component, C3A.
Okay, so the inflammatory component causes inflammation, but where does it cause inflammation?
Okay, so these excellent question. So these immune complexes, what happens is in normal people, these immune complexes are cleared from the circulation quickly. And what happens is they bind to red blood cells, these immune complexes that are formed, and they are shuttled to the liver and the spleen, where there's specialized cells there that degrade these immune complexes. Then the red cell returns to the circulation to find more immune complexes and to bring them to the liver and the spleen. So that's called the immune complex clearing mechanism.
Gotcha.
Something I worked a lot on when I was a graduate student. So very familiar, and it was discovered actually by Lee Hebert at the Ohio State University. Now, contrast that with individuals that don't clear immune complexes in a fast way. What happens is they deposit in blood vessels, they deposit in the brain, in heart tissue, especially in the kidney. And what happens is the activation of complement on tissue surfaces generates, things like vasculitis, kidney disease, graft rejection. So what you see is a whole host of different types of diseases and conditions that are caused by the direct activation of complement on the surface of the tissue. But what happens even further when these complexes deposit is C3 is the main component here. So think of it as a main regulatory molecule. So C3A splits off, generates tremendous inflammation. However, it doesn't stop there in individuals that are susceptible. What happens is it ticks over a pathway of proteins called the alternative pathway. And the main thing there is it forms, the end pathway is it splits another molecule, C5, into C5A. So just think of it, C3A, C5A, tremendous inflammation generated by those two molecules. But to make matters even worse, the pathway's end result is called the membrane attack complex, or the MAC complex, which forms right on the cells, and it punches a hole in the cells, and now you start to actually lyse your own tissue. And that's really evident in, like I say, graft rejection, kidney diseases like glomerulonephritis and those sorts of diseases. So the end result is tissue lysis, and now you've set yourself up for an exacerbated process of more immune complexes and more inflammation and cell lysis. And this thing just keeps going on and on until at some point you end up, literally in a tertiary care setting. So they can either shut this system down or you need some sort of tissue management.
Wow. So it really can affect any tissue in your body, at a cellular level.
Yes, any tissue in the body. And what's interesting is that people that are particularly susceptible to immune complex disease, there's receptors on red blood cells that bind specifically to immune complexes so that they can be removed efficiently. And that's called a CR1 receptor. So it's just a receptor. It picks up the immune complexes, shuttles them to the liver and spleen. They're dropped off like kids at school off a school bus, and then enters the circulation again. Other people, what happens is they have low receptor number. So low numbers of receptors on the red blood cell correlates to people that don't clear immune complexes efficiently and to enhanced disease entities and processes. So it's really linked to a receptor on the red blood cell.
So you used a lot of words that a lot of people are not going to fully grasp. So let's boil it down a little bit.
Yeah.
So the food sensitivity.
Yeah.
How is that different from, you explained how it's different from an allergy, but when people say, oh, well, I'm dairy lactose intolerant, is that the same thing?
That would be an enzyme deficiency. So that's more or less intolerance, and that would be much like also a gluten or gliadin, where that's more or less an intolerance at the level of the gut cells. So I don't want to be too obtuse here. So let me boil it down for you. What happens is you eat a food, it gets into the lymphoid tissue, into the gut. You produce an antibody. That antibody then forms an immune complex by binding to the particular food antigen. That then activates a system that generates inflammation that we can measure. And people that clear immune complexes, food immune complexes quickly, chances are inflammation will be minimal. Those that can't clear these immune complexes, inflammation will be much more severe. So there's the tie-in to the FIT test. It measures both innate, which is the complement system and inflammation, and acquired, which is the antibody system, IgG 1 through 4. And then we put those signals together to then give you a good indication or estimate as to whether you have a positive reaction that could be a potential food sensitivity.
It's really fascinating because I did the test, and there were a lot of foods that would be categorized as healthy, right? So typically when you hear about inflammation, the first thing a doctor or a nutritionist might tell you is, all right, we'll cut out gluten and dairy, the ones that people typically have an intolerance to. But when you're talking about a food sensitivity or an IgG allergy or sensitivity to a food or an additive or a coloring, how do you indicate which foods you're actually sensitive to?
Okay, so the FIT test will measure the antibodies and immune complexes and gives you a signal. And we rate that signal in intensity from 1 being barely positive or low positive to 4+, very strongly positive. So what you do, so this test gives you empirical evidence that you've tested positive, IgG and immune complex positive, let's just say for a particular food. So what you do is you then move that into an elimination diet, which is really the gold standard. So what you would do is you would eliminate that food from the diet for perhaps 6 to 8 weeks. Now, some practitioners go longer, some go shorter. But during that time, what happens is you've eliminated the food, antibodies are cleared from the circulation quickly. And immune complexes are in normal people are cleared within 5 minutes, 10 minutes. But antibodies have a half-life of about 3 to 4 weeks. So what happens during that 8 to 12 week period is antibodies have a half-life, let's say, of 3 weeks. So every 3 weeks, you have half as much antibody against that particular food in your system. So during the elimination phase, the key is there, you want antibody to go down. And what you want to do then is after that time period, you can then reintroduce that food into the diet. Let's say you reintroduce it into the diet on a Monday or, Monday and Tuesday. Some people do it once, some people do it several times. So you reintroduce that food, and then it's a delayed reaction. So you look at the person's symptoms. Let's say if they ate it on Monday, Tuesday, Wednesday, Thursday, even Friday. And what you're looking for is the B cells that produce the antibody are still there, and they're in a proliferative stage and they're active. So what happens very often is if that food is reintroduced into the body, antibody will start to be produced quickly within 12, maybe 24 hours. And then what happens is immune complexes start to be formed again, and then inflammation starts to be generated. So what you see in the patient is in 2 or 3 days after they've consumed the food is they start to experience symptoms again. And the symptoms, I think, as we all know, for food sensitivities, they're widely varied. Anything from digestive problems to headaches to different types of skin disorders, etc. So they're quite varied. So you look for the symptom. And if the person says, oh my God, I ate it on Monday, and by Wednesday, my migraines were back, or my intestinal problems are back, you've pretty well put your finger on what we call a trigger food. And what I generally recommend is try that one more time the next week, just to kind of confirm it. So the next week, eat it on Monday. Sure enough, by Wednesday, the migraines are back. So what you've done is you've identified a food that triggers symptoms in that individual. So now you want to get those foods out of the diet for quite some time, 6, 8, even 10 months. And then during that time, what happens is the B cells become quiescent. So they're not in the proliferative stage. They're in the germinal centers, or their homes in the Peyer's patches and other lymphoid tissue. So they reside there. So they're not active anymore. The antibodies have gone down essentially to nothing. So there won't be any just endogenous antibodies floating around. But just as important during that 6, 8, 10 months is if leaky gut or irritable bowel were part of the process that set you up for food sensitivities, leaky gut will start to heal. And when it does, the tight junctions in the gut close. Food can no longer get through the gut lining. They no longer stimulate the cells to produce antibody, so you don't form immune complexes, and then you don't get the attendant symptoms when you reintroduce a food like that.
That's really interesting. So thinking about the test that I took. So I was expecting to be sensitive to foods that I eat or beverages that I drink on a regular basis.
Yes.
There were 2 or 3 actually on there that I haven't had in over 2 years.
Mm-hmm. Okay.
Pineapple was one of them. Yeah. Asparagus was another, and collard greens was the third, which are all healthy foods. Mm-hmm. So how would I have a sensitivity to foods that I haven't eaten?
Okay. Again, a good question. So the test, if you're positive to a particular food or additive on the FIT test, that indicates that you may have a sensitivity. It doesn't mean just because you produced an antibody, you do have a sensitivity. And that's because IgG 1 and 3 activate complement. So the C3 that we talked about, and generate inflammation. Very strong activators. IgG2, less than IgG1 or 3, but still activates complement. So think of IgG1, 2, and 3 as strong activators of inflammation, bottom line. There's another one antibody, IgG4, and it's thought of as a quotation mark good antibody. And the good means that IgG4 will bind to a food antigen and form an immune complex, but it does not activate complement and generate inflammation. So many times you can test positive for a food, but not show a sensitivity. And that's because the response is either mostly or entirely IgG4. Now, that brings another question is, well, why do some antigens generate an IgG4, which is potentially inert from producing inflammation, and others generate the inflammatory component? And you know what? It's just not really known. I mean, that really is the $64,000 question. If you could answer that, that would be a Nobel Prize. I mean, literally. But they do, in some individuals, what you see is the reactions are skewed towards G4, and other individuals, the reactions are skewed more towards IgG 1, 2, and 3. And I guess the jury is out, so to speak, but what people surmise is that in our bodies, we have a background genome of about 40 immune response genes that code for all types of cellular receptors, cytokines, and lymphokines. And what people feel, the general consensus is that this background genetic makeup of an individual can either skew you towards one antibody or another, or in some individuals, for instance, a half-life of an antibody is 3 to 4 weeks. Well, some immune systems don't read the textbook. I mean, because you can be positive for a food, a bacterium, or even viruses sometimes a decade after you've consumed it and you don't eat it anymore. So why do these cells remain active such that you can measure an antibody against something that they've had no exposure for a very long time? And then other individuals, you'll remove a food from the diet, and the antibody response will drop like a stone, and they'll be practically negative in 8 or 12 weeks. So again, I think it's a background genome contributes to the overall immune response. And you know, a simplistic answer isn't always the right answer, but I'd say in most cases that's what happens, is you get quick clearance, and it's a question of IgG that causes inflammation and IgG4 that doesn't, and that's what we see, you know, in a particular individual.
So in my studies, when I was doing the program through the Harvard School of Public Health and the Culinary Institute on culinary medicine, which is actually a great program for anybody who is looking to educate themselves on food as medicine. We talked a little bit about the food sensitivity test. And so 3 years ago, I went out and I found a test that could test me at home. And I bought the test. It was a Pinner test. And that's why I cut out pineapple to begin with.
Yeah.
And I was very sensitive to it 3 years ago. And so I haven't had any collard greens and asparagus. I've probably eaten more recently because I eat very plant forward. And so I eat a lot of vegetables, and sometimes I'll go out for dinner and I don't know what's in the stir fry. So that makes a lot of sense to me. But tell me how your test is different from the other tests that you can pick up online, that you may have seen on social media, that your doctor or nutritionist may have recommended before.
Yeah, I'm pretty familiar with the food sensitivity landscape, so to speak, and testing out there. So there's about 3 really basic types, and then there's some outliers that I won't discuss. But first of all, there's the IgG only test. So that measures the acquired immune system, right? It only measures IgG 1 through 4. So you can think of it as it will have a reagent in the kit, so to speak, that gives you one signal. And that one signal generates from IgG 1 through 4. Now compare the FIT test to that. The FIT test measures the acquired immune system, so IgG 1 through 4. So we get a signal for that. And then it also measures the innate immune system, which is the inflammatory pathway. We get another signal for that. So what happens is the FIT test combines the signals so that you get a much higher response. You can imagine you get one signal in one test, You get double the signal in another test. So you get better sensitivity. So that's what you see kind of from a laboratory perspective, and also what you'll visualize on your test report. So, and then what the inflammatory component does, the ability to measure that, it really adds a lot of specificity. So these tests are designed so the more reagent you add to detect the IgG, the higher the signal. So you get a higher bar, but you get higher background. And by that, I mean, you get false positives. What the FIT test doesn't have to do is add more of the conjugate to give you a higher signal, because it's already got double the signal intensity right from the start. So we get less false positives because of that. And so for less false positives and higher sensitivity. So I think when you look at the FIT test, the food sensitivity test at KBMO, what you'll see is good, clean signals and not a lot of background stuff that it's like, okay, it could be, might be, maybe positive type of thing you see. Yeah. So it really, so, and you get fewer positives so that you can actually design an elimination diet without removing every food from every category. And the good news is that the sensitivity is gone, but the patient is starved. You know what I mean? So it really facilitates the practitioner's ability to then take it to the next level and figure out which food may be involved in a particular sensitivity. Because I've seen other tests out there, there's 24, even 30 or more positives. I mean, what do you do with a test like that? I mean, how can you possibly even design a diet that a patient would be compliant? You can't. Contrast that with the FIT test. Typically, we see 6, 8, 9 positives. If there's leaky gut, and we can talk a little bit about that later, where the intestine has become permeable due to some inflammatory insult, let's say, what happens is you may see 15 or maybe 18, but generally it's a manageable amount. Now, so that's the FIT test. So IgG only versus the FIT, which measures IgG and the inflammatory component. And then the third type are cellular tests. And there's a couple out there, and I'm not in the business of criticizing anybody's test. That I will not do. But I will tell you the comparison is this. The cellular tests measure morphology. They measure a phenomenon. They do not measure an analyte. And then by an analyte, IgG is an analyte. The inflammatory component is an analyte. It's a specific component that you can measure in the blood. These cellular tests measure, does a cell shrink or does it swell, or is the extracellular volume higher or lower? And then they say, if you expose that cell to a food and it swelled, then they're going to produce a lymphokine or cytokine that would cause inflammation. Well, number one, I just say, look, I'd be a believer. Not one of these tests has ever shown that these cells release a lymphokine or a cytokine. Not at all. When I was at MIT, I worked extensively with these types of cell assays, mainly with a variety of RNA viruses, much like coronavirus and polio and HIV. What we measured was the actual end result was, we could say that IL-6, TNF alpha was released. These tests are extraordinarily difficult to control and extraordinarily expensive to run, and you only run these in a research lab. So these other cellular tests out there expect you to believe something's been released without actually showing you any evidence. So what I say is, if you tell me a cellular test works, is you show me the evidence. And if you show me the evidence, that at that point, I'm a believer. But until you do that, I don't know what's going on. And then to make matters worse, some of these cellular tests, they say, oh, it's pro-inflammatory. Well, that's not true, because these lymphokines and cytokines can be pro-inflammatory and anti-inflammatory. So a cell that swelled or shrunk and released something, it could be an anti-inflammatory cytokine. So until you show me like a TNF alpha, tumor necrosis factor alpha, which we know is involved in all kinds of inflammation. You show me that's been released against the food, and at that point, I'd be happy to go along.
Well, the proof is really in the pudding, as they say, right? So 5 years ago, I was diagnosed with a rare autoimmune combination called lupus, which is rheumatoid arthritis and lupus.
And lupus, yeah.
And it was kind of a where there's smoke, there's fire type of diagnosis. I had major inflammatory issues. My endocrine system, my lymphatic system was all shutting down. And so that's why I was seeking these types of tests. A lot of people are seeking these tests these days because they've put on 30 pounds during COVID, kind of sitting around and not doing so much. And everybody's looking to lose weight now that the world is opening back up. Obviously, inflammation in the gut can cause you to retain weight and can cause bloat, brain fog, and can lead to a myriad of diseases, including autoimmune disease.
Yeah.
So when I was able to heal myself from autoimmune disease, my doctor actually put me on a pretty crazy food elimination diet. And I thought I was going to lose my mind because you test for 176 different foods, additives, and colorings. How is anyone supposed to effectively do a food elimination diet where you're removing all of those foods from your diet? You simply can't do it. So that's why these tests are so important. But if you're going to pay for a test and potentially pay, several $100s for a test, you want it to be as accurate as possible so that you can remove inflammation as quickly as possible from your body. Now, we talked a little bit about leaky gut, and I wanted to talk about leaky gut because it's actually something that's plagued me. And I found when I heal my leaky gut and when I remove the foods that are causing inflammation, there's a direct correlation to that. But I actually feel like I put on a little bit of weight. I when I'm sick and unhealthy, I'm too skinny. I lose too much weight. And, my mom will come over and grab me by the shoulder and say, you need to eat something, but I need to eat the right foods for my body. So when I did this test, I was surprised to see that I actually still might have some indicators of leaky gut. And I wanted you to tell me what that is and how you test for that, because that's it's something that a lot of people don't know they have. They really don't know much about, including, zonulin, which you mentioned before, right? That's the indicator. Right. So tell me a little bit more about that.
Yeah. So leaky gut has really come to the fore, probably in about the past 20 years. And the major proponent of that is through a molecule called zonulin. And here's kind of how the cascade works, is that you get exposed to an inflammatory component in the gut. And let's just say gliadin, a gliadin peptide. Everybody is familiar with that. So that binds to a receptor on the epithelium of the gut, and it tells the cell to produce zonulin. So the inflammation says, okay, cell, produce zonulin, and then zonulin is synthesized and then released from that enterocyte into the lumen of the gut. Now, zonulin is in the gut, and what happens is now that binds to the same cell or an adjacent cell through another receptor. And again, it's not important just to understand that zonulin's produced, it binds to a receptor, and then triggers the cell to pull apart the tight junction between cells. So there's the enterocytes in the gut have a tight junction, and the tight junction has a protein there. And the zonulin tells the cell to now pull that. It's like pull the stopper out of the bottle, boom. And now you have a channel from the lumen of the gut to the underneath cellular epidermis and then into the Peyer's patches directly. So what happens is zonulin tells the cell, open the tight junction, just like a traffic cop directs traffic. The food antigens get through that junction, which is now open, and now you start to produce an antibody against that particular food, and you set yourself up to produce a food sensitivity. Now, if you have a lot of zonulin release, then that is what they call leaky gut. And leaky gut is the release of zonulin that opens many, many tight junctions between many, many cells. So you're what used to be a pipeline that was patent now becomes a colander, and everything starts getting through those holes and where it shouldn't be, which is into the lymphoid tissue. So now you've got a diffuse reactivity in many people against a lot of food and other types of molecules that they never even had before. And I can just back up a little bit on this. So again, I'm preaching to the choir here, but the medical history of the individual is very, very important. And that's one of the diet, the medical history, the medications, and also supplements today. A very, very good background to have when looking at a food sensitivity test. Now, having said that, for instance, Lindsay, you mentioned you had lupus and rheumatoid arthritis. So what do we know about the treatments there many times? Well, methotrexate very often, prednisone, or other steroids, or Humira, or Enbrel, or other types. And they're very effective at controlling inflammation and very often work well. But they also destroy the gut lining because they destroy the gut microbiome, and they expose that gut lining now to things they shouldn't be exposed to. So either the direct, like methotrexate, toxic as anything, that directly can damage the gut. No, not even any question about that. So that sets up an inflammatory process and could even set up the production of zonulin itself. Or it kills the bacteria, which now no longer coat the gut and provide that lining, which protects the gut from other things that you consume that can generate inflammation. So it's a little bit from knowing the history, you can understand, did the food cause the leaky gut? Meaning, did gliadin cause the leaky gut through zonulin, or was it an antibiotic or a chemotherapeutic agent or something like that, which are directly toxic, which then damages the gut and starts the whole process? And what you see as an end result is a food sensitivity, but really what started it off was the person had Lyme disease and they were on a course of antibiotics for 8 or 10 weeks, the doxycycline, which killed the Lyme parasite, Borrelia, but now it also damaged your gut so badly by killing the microbiome in your gut that now it set you up in what we see as food sensitivities because you have leaky gut. So it's a by knowing the medical history, you'll understand, and diabetes is another one that sets people up for these types of leaky gut. So you'll understand from the medical history kind of whether the food caused the leaky gut or whether perhaps it was a medical condition per se that may have set you up for leaky gut, and then the end result is a food sensitivity.
This is amazing because when I want to show, if it's okay with you, I want to show my test.
Sure, please.
All right, so here we go. So this is my test. Can you see that pretty clearly?
Yes, I can. Yeah,
okay.
No problem.
So when I was going through this,
there we go. Page 2, perfect.
There we go. Okay. When I was going through this, I see the 172 different foods and additives and colorings, and obviously the bars that are in red had that IgG4 reaction.
Good, yeah.
And that was banana and asparagus, and I probably had just had asparagus. I can't remember when I just don't like the way that, it makes things smell.
Okay. Okay. There you go.
So I don't eat a lot of it, but bananas I was having in my, smoothies every day just to, that I was making for my kids.
Mhm.
And coffee, I just started drinking coffee again with some vanilla almond milk. So vanilla, and coffee made sense to me. Um, Cilantro I eat a ton of. That's really been hard for me to cut out. But this has been so helpful because I actually feel a lot better since I've cut out these foods. But my zonulin is positive.
Mhm.
And when I saw that, it really kind of, I feel like I'm my own bearer of bad news, and I've been the bearer of bad news to other people who don't want to cut out some of the foods that they show a sensitivity to. But I also noticed that there's candida.
Mhm. It's negative.
What is that an indication of? I'm negative for
That's a
that.
good point. That's a
Yeah.
good point. So candida, so that's Candida albicans, and that's a yeast that's normal flora for skin, on skin and mucous membranes, especially the gut, in every single individual. So it's kind of a commensal organism, and normally it's in the gut in relatively low numbers when compared to the other types of gut bacteria. But what happens sometimes is during an inflammatory process, again, antibiotics or some sort of endogenous disease, candida can overgrow. And when candida overgrows, it's either in response to a damaged gut or it can directly damage the gut. So what we're measuring there is an antibody against candida. It doesn't measure an infection. It just tells you, did those candida antigens get through the gut wall, and did you generate an antibody? Because you should not normally have an antibody against candida. So in your case, it's negative. So zonulin is slightly elevated, so it's a mild reaction. So, I look at it this way, and I almost look at leaky gut as a spectrum disease where everybody has some amount of leaky gut. There is no perfectly, your gut is not like a hollow pipe that has no pores at all. I think that in certain individuals, you get a little leaky gut, meaning these tight junctions break and reform during the normal course of just consuming foods or being exposed to things. It's when you have many of these tight junctions open, that's when it really sets you up for disease. So I say it's a spectrum disease, much like autism, where autism can be very mild and manageable to the extreme spectrum, where you have a pretty unmanageable case to the point of institutionalization type of thing. So again, leaky gut can either be on the mild end or on the severe end, but I think everybody has some amount of it. And so a 1+, if you had high candida, let's say candida was 3+, let's say zonulin was 3+, let's say you had 10 or 15 high foods, I'd say, okay, that paints the picture of potential leaky gut. And then when you say, okay, I'm looking at my client, I'm looking at my patient, the symptoms are bloating, diarrhea, maybe some severe headaches, but mostly intestinal problems. So the symptoms kind of match the picture of what you'd see for somebody who had leaky gut. So when you put the test, the FIT data together, high candida, high zonulin, a lot of foods, that tells you potentially there could be leaky gut. And then when you put it together with the symptoms, it says, boy, we're probably looking at leaky gut here at some level. So let's treat the patient as though they have leaky gut, maybe a gut healing protocol. Could be probiotics, it could be something like glutamine supplements, it could be other things that would be efficacious. And the reason
glutathione is something
glutathione,
Yeah.
same thing. Yeah. So the other thing and the reason I mention the brain is because in the brain, much like the intestine, there's a system that is a partition, let's say, between the brain and the vascular compartment, and that's called the choroid plexus. And what do we know about that? It's tight junctions. So very often when you see release of zonulin and damage to the gut epithelium because tight junctions have been opened, these also affect the brain. And what happens is food particles and other types of ingredients can cross that blood-brain barrier, get into the brain. And so now you see people that have mood changes. You see people that have severe headaches. You see other type of mental issues. And people used to say, "Oh, come on, that's food doesn't cause that." Well, I think most certainly it does, and it's been shown to in a number of papers that food definitely has an effect on really severe mental conditions. And most likely it's because disruption of tight junctions between the cells in the blood-brain barrier have been opened, and things get into the brain that shouldn't normally get there. So there is some correlation between the gut and the brain, and that access also of hormones that are constant crosstalk between the brain and the gut. The brain tells the gut what to do, the gut tells the brain what to do. So that's another layer of complexity as well.
And so for just to kind of recap and stitch this all together. So first, in the beginning, you mentioned that a normal body would basically expunge or flush out these antigens, right?
That's correct. Immune complex is correct.
Right.
Yes.
That's not the complex. So does that mean that the people who are showing a sensitivity are not normal? Or their bodies are not functioning on a normal basis? Is it a downward spiral? So if you have inflammation, you can't actually flush out these antigens, the complex?
I think it's one thing to consider, because what they've shown in these individuals that are susceptible to immune complex diseases is there's 3 genetic types. There's individuals that produce a high receptor number. Those are normal people that clear and generally don't have these attendant diseases. You have moderate, and then you have low. And low receptor number genetically is linked to many diseases like systemic lupus, arthritis, and other types of diseases. So I'm just trying to paint the picture that it's complex, and it's one thing that you may want to consider in an individual that you see that has a lot of inflammation, and you think immune complexes from food especially may be a feature of what you're looking at. So It doesn't necessarily have to happen, but it may.
Well, because thinking about, crossing the blood-brain barrier and having, I actually used to take an anti-anxiety medication, I think because I was so inflamed. And I've noticed that when I'm not eating well, and my inflammation is high, because I can feel it in my wrists, and I also start to get anxiety again. I have panic attacks. So I also know from speaking with other providers that I've worked with that you have more serotonin receptors, which makes you happy, in your gut than you do in your brain.
In your brain, yes.
So it's really important, I think, to stitch it all together, that you're right. Food is not necessarily the end all be all, but inflammation is really the cause of all evils when it comes to our health, and not just our physical health, but also our mental health and well-being. So going back a little bit to the test. So the KBMO test that you have meticulously designed, what should we do first? Like, what's the there's a lot of different tests that you guys offer. There's
Mhm.
the Fit 22, there's the Fit 176, and then there's a bunch in the middle. And I know that
Mhm.
they're varying price points. Some people want to dip their toe in
Mhm.
and just test for, a couple of the main inflammatory foods.
Yeah.
What would you recommend we do as people who are trying to live a healthier life?
Yeah, and I'll preface it by saying that I'm always mindful when I talk to patients or providers that, tests are expensive, and I'm not in the business to waste people's money or make them spend money unnecessarily. So having said that, as you said, the Fit 22 is really just a screen. It's good, and it functions just like it should. It screens you. But the information from that, if you said, "Oh my God, I'm sensitive to a couple of things there," boy, I better do the 132 or the 176 to really flesh it out and see if there's anything else. So it's kind of like a test that says, "Hey, look at me. If you see anything, you probably want further testing." So I recommend, for people that suspect they have a food sensitivity or want to enhance their performance, like professional athletes, take the 132. The 132 is a solid test. It's a mid-range price. It includes zonulin now as a leaky gut marker, and will also contain zonulin IgA in a couple of weeks. So that's just coming out of development. So it's zonulin IgG. It will also have IgA for the same price. So I would say the 132 is a very complete test, and really gets you about 85% of the way there. Now, if you say, okay, money is not an object, and we have a lot of those people, I want the 176, then that's a much more complete test. But the 176 focuses more on some of the foods that, like 10 years ago, 15 years ago, when the 132 was developed, diets have changed. Diets have morphed so that people want to eat healthier. So what we've added is ingredients to the 176 that are more or less new entries into the diet, and that we haven't seen, a lot of previously. So it tests some of the newer foods that are in there. And I can't think of any, like buckwheat or some of the others that they're in smoothies or health drinks or supplements and things like that. So it really is a much more complete test, but it does come at a cost.
Right. So thinking about cost, what's been really cool is working with the advanced surgeons practice. And some of the patients from advanced surgeons have also wanted to become my clients, and they are looking to lose weight through diet, lifestyle, and I'll help them with coming up with different recipes and actually grocery shopping with them and teaching them more about their diet and their lifestyle, because every body is different and everybody is unique. And so the Small Hinges program really focuses on what small changes can you make to your diet and lifestyle that will have a big impact on your health and well-being. And what we found so far is, with the addition of the data from your test, we typically do the 132 or the 176 in the practice on our patients. What we found is that not only are people losing weight, because inflammatory weight is actually pretty easy to lose once you remove the triggers of inflammation, but they're also healing from other things. So I had one client who was unable to work out because she had such tremendous pain in her hip that after just 4 days of removing the inflammatory foods, her hip pain was completely gone. And
Wow.
this is the proof in the pudding type of situation that we're talking about before. I found it in my own body as well. I'm actually sleeping better. I don't have panic or anxiety, even though going through a lot of life changes right now, and probably should have a little bit more panic and anxiety that I have. But I'm seeing it now in the practice. And we've tested over 24 people. And
Right.
the people who have removed the inflammatory foods from their diet have seen a tremendous shift in not just the way that they look, but also the way that they feel and their level of happiness and their ability to function at a higher level. I've noticed my brain fog. I'm a single mom with 3 little kids, and so I have chronic brain fog.
There you
But I feel
go.
a lot sharper, and now I've even cut out coffee, as you saw in my test, and I'm still functioning at a pretty high level. So I see that the proof is in the pudding, and in the practice, we've actually thought about retesting
Yes.
the patients and our clients after the 6 to 8 weeks, and after they have started to put the foods back into their diet one at a time, and see if there's still an inflammatory trigger from those foods, so that some people who have had to take out eggs, let's say, for example, or bacon in some cases, wheat and wheat gluten, are excited about putting those foods back into their diet. And so what would you recommend from a testing perspective? So let's just say I did this test in February. I've removed those foods for now a solid month. I'm feeling pretty good. I'm going to keep those foods out of my diet for probably another month, and then I'm going to try to reintroduce them and see how I feel. But should I get a test redone? Would you recommend that, or should I wait?
I'll tell you a little bit about what we've seen, and then I'll get right to your question. So what we noticed is that you'll test people initially when they come in, and we'll get a symptom checklist. So they'll have, and we'll look at the severity, from 1 to 10, 10 being the worst. So they'll come in, they'll have high antibody and immune complex reactivity to a number of foods. So we've documented that. And then we take a look at their symptom checklist, migraines, severe, gut problems, etc. And so we get an idea. Then we'll retest them in probably, we did in one clinical study in about 10 months. And what we find uniformly is in those cases, overall, the antibodies have dropped significantly. So we look at the retest at about 10 months. So we see antibody titers and immune complex have gone down just dramatically. Patients are feeling better. And then what we say is, okay, now redo the symptom checklist at 10 months. And what we find is the symptoms have universally lessened. Now, the way I put it is, nobody's going to drop their crutches and walk after taking this test. That's not not the goal here. But what we typically hear, since you mentioned migraine, my migraine might have been an 8 months ago, and I have 3 or 4 migraines every week, and they're so severe I have to go lay down or I have to take medication. After 8 months, they're feeling better, antibodies low, and they say, yeah, I still get a headache, but it's every couple of weeks now, and it's not nearly as severe as it used to be. And you know what? I haven't taken medication in a while. So we look at that as a win, because most likely inflammation's been reduced, and the real evidence is the patient's feeling better, and the severity score of their symptoms has gotten better dramatically. And so again, some people will tell you, oh, will you take a test? We'll cure you. No, I'll never tell anybody that, but we'll make you feel better. If you reduce inflammation, the goal is make you feel better. So having said that, I would say retest somebody every 8 to 12 months, because I think somebody who's suffering from a food sensitivity that's fairly severe will have some level of leaky gut, and you want to get the food out, get the inflammation down, get the gut healed, so you don't have this intrusion of all these foods through the gut wall. And so the patient should start to feel better at that point. And then when you retest them, the confirmatory is, well, they're feeling a heck of a lot better. And we look at this. Wheat used to be 4, now it's 2. Milk was 3, now it's negative. So we see that sort of pattern of reactivity, but the main cornerstone is people feel better. So to answer your question directly, I would say about 8 to 12 months.
Okay, that's great. So I'm looking forward to retesting myself because I already feel better just within a month. And I also know that this will, I'm 40 now, and everything starts to fall apart when you turn 40. And so I'm looking to stave off some of the
Mm-hmm.
diseases and issues that can come, after you hit a more advanced age. But also
Yeah.
for women, what I've noticed, especially in my practice, is that when you have leaky gut or you have an inflammatory disease, it throws off your hormones, which throws off the rest of your body,
Yeah.
and pretty much everything from your mental health to your physical health. And so it's really important, not just at my age, where I've already had 3 kids, but in working with people who are looking to conceive. It's very important to make sure that your body is a good warehouse for baking a baby,
Mm-hmm.
because
Yeah.
I've seen I've seen inflammation really cause a lot of issues in conception, and so I just wanted to throw that out there too. It's not just for people who
No,
are ill and not feeling
no.
well. It's also for younger people.
Yeah.
And even, I mean, I don't know how young you would recommend we test potentially our children, but I have one child who was born with low muscle tone, and not
Mm.
just her exterior muscles, but also her digestive muscles. And so she's had to be on a very clean diet. She's only 7 years old, but I was thinking about, even testing her because,
Yeah.
um, and potentially all 3 of my children, because it's just helpful to have all
Yeah.
of the data and have all of the information. Now, if I could figure out a way to get their blood out of them without pricking their finger or drawing their blood, that would be another thing. But tell us a little bit before we have to go,
Yeah.
um, about the difference. How do we get the blood sample? I just mentioned a couple of different ways, and how can we order them? So I know that we can send tests to people's homes if they
Yes.
don't live in the area where we have different practices. But how can we go about getting this test and get ourselves on the right track?
Yeah. Well, great. Yeah. Let me just say one thing. So generally, we test 3 types of people. Those that are really sick and they've been to multiple doctors and they're at wit's end, and finally they go to someone and says, "Let's look at food sensitivities." You get another subset like you, where they have children or you're individual and you're just plain curious. I'm not feeling so well. I don't feel terribly bad, but do food sensitivities play a role? And then you get the third, where high performance athletes, and we test a lot of professional athletes that want to optimize performance. So those are kind of like 3 opposite ends of the spectrum, if you will, types of customers. And we can test them as young as about a year and a half. That's when the immune system becomes mature. So having said that, you can go to www.kbmodiagnostics.com, and it'll give you a phone number so you can phone in, or you can set up an account directly online and you can order tests directly. You can pay generally by credit card is how we do it, but there are a number of payment options for various practitioners. And then what we'll do is we'll drop ship the kits upon your instructions. So you'll say, look, customer X needs a kit, we'll send it. Customer Y over here, or send some to the office because we have individuals coming into our practice and we can take the sample right there. So there are 2 types of samples. So there's the blood draw, and we can send a phlebotomist to your home or to the practice, and they will do a typical serum draw in a red top tube. You send that to the lab. We can analyze that. The other way that people really prefer now, it's about 80%, is you just do a simple finger prick. And so there's a lancet, you prick the side of your finger, and you dot a filter paper card that then you send to the lab after it dries. And then we extract the antibodies and immune complexes from that, and then we measure them in the fit test. So we can drop ship, we can send to your office, we can use a phlebotomist, yours or ours. You can do a finger stick, but the end result is they end up in our lab, as our own clinical lab, and about 7 to 10 days after the lab receives the sample, then we will post the report to a HIPAA compliant system called box.com. So we'll set up a file for you, like a file folder. You'll have your patients in there, and you just put your username and password in there. You can access all the information in there, and then you can use that to communicate with your patients.
Awesome. And where I post this video, I will also include the link and my provider code, so that if you're a patient directly and you want to order the test to your house, my code is C-11533 for anyone who wants to order the test directly. But I think that this is something, I'm a big believer in data. And you obviously are the master wizard of all things data and health. And when it comes to food sensitivities, I have learned so much today. I thought I already knew a lot about it, but I wish I could talk to you all day about this, because I think it's really important for all of the people out there, not just the ones in those 3 categories, but all people, to have all of the information about their health, so that we can really take an active stance and be active participants in our own health and well-being and happiness. And this is just one really important data point to have in our quiver of arrows against, in the battle against illness, disease, depression, anxiety, obesity, all sorts of different things. So I thank you so much for joining me today, and I look forward to working with you and continuing to help all of the people that we have the opportunity to test and to help down this path. Great.
It's been a pleasure. Thank you very much. And if you have any questions, send them to Lindsay, and I'll be happy to get back to you. Or we'll be happy to get back to you.
Yeah, we'll be happy to get back to you. You can email me at info@smallhinges.health if you have any questions.
Thank you again.
All right. Have a great day.
You too.
Thanks.